Myself, Dr. Kiran Kammar from Yenepoya Homeopathic Medical College and Hospital, Naringana, Mangalore, Professor and HOD in the Department of Gynecology and Obstetrics. Today, I would like to speak a small heading related to the awareness on homeopathic management for the menstrual disturbance in the teenagers. So it will be a small session which will just highlight on the problems of the menstrual cycles in terms of the teenagers. So the session is going to highlight, as the objective say up, is related to the sufferings of the teenagers during the menstrual cycle, the self-care which is supposed to be done to maintain the normal menstrual cycles, and the scope of homeopathic management for the menstrual disturbances. So to begin with, first let us understand what is menstrual cycle. Menstrual cycle is a period of approximately 28 days. The cycle which starts from the first day of menstrual bleeding to the day just prior or one day prior to the next onset of the menstrual bleeding. On an average, it is around 28 days. But for some females, it would be seen for around 30, 32, or even it can be up to 20 or 25. If the cycles, the total duration of the cycles is beyond 35 days or 40 days, then we would call it as a prolonged menstrual cycle. And if the cycle days are within 20 or 22 days, then we would call it as short menstrual cycles. There are many changes taking place in any of the female's body during this full phase of the menstrual cycle. Though it is a period of 28 days on an average, we are going to see three important phases in the menstrual cycle, wherein the ovaries, that is the area or might be the gonads what we call it, which are going to prepare for the eggs, and those eggs, which one of the egg will come out at the time of ovulation, is going to help us for the fertilization. After the ovulation, if at all, the ovulation which is normally going to take place on 13th or the 14th day of the menstrual cycle, if at all this egg goes ahead for the fertilization, the next phase of the menstrual cycle is going to be helping out for the maintenance of the pregnancy. But if not, when the fertilization doesn't happen for the ovulation, then we would call it as secretory phase, and during this secretory phase, there will be just the preparation of the endometrium, and if the ovulation doesn't take place, this secretory phase of the uterine lining is going to shed off. Like it will not function further after a period of around 8 to 10 days. It will not function and it will shed off. This shedding of the might be the mucosal lining of the uterus is what we call it as menstrual bleeding. So it is not only the blood which is going to flow out, but along with the little amount of blood, even there will be the mucosal secretion or the watery discharges of the uterine lining, which is going to come out in the form of menstrual bleeding. So for all these changes to take place, basically in the female body, there are 4 important hormones which are regulating these changes. That is follicular stimulating hormone and the luteinizing hormone, which are being secreted from the pituitary gland present in the brain, just beneath the brain tissue. So these 2 hormones basically prepare the ovaries so that the eggs, or what we call them as follicles, they are going to keep on growing day by day from the first day of the menstrual cycle till the 14th day. On the 14th day, the luteinizing hormone LH, which is going to suddenly rise up and help out for the ovulation to take place. If the ovulation takes place, then there will be a probability of conception which may happen in the adult females. But now at the moment we are speaking is about the teenagers. So let us concentrate on the problems which are going to come up with the menstrual phases. So once the ovulation takes place, then followed by that will be the secretory phase, and this phase is being controlled by the hormones of progesterone. The progesterone is also the hormone which is going to come out from the corpus luteum, or might be the modified eggs or the follicles of the ovaries. So that is in short about the hormones and the menstrual cycle. This is not to be dealt in detail as the heading is related with the disturbances of the menstrual cycle. Hence, we move ahead to the next part, that is about the problems of the menstrual cycle. So, very commonly in the teenagers, that is for the girls between 14 to around 19 or 20 years, at this period, most of the girls do come out with one or the other problems during the menstrual bleeding phases. Like it can be in terms of pain in abdomen. Sometimes some girls may never show any pain, but for some people the pain can be seen at different varying degrees of pain. Like one cycle they may have pain, for the next menses they may not have pain. The pain could be mild at one instance, the other after 2 or 3 months the pain could be very severe, and the pain or the type of pain may never remain the same in a same female. So also comparatively from one girl to the other girl, the pain will never be the same type. Some person may speak about pain which is to be seen in the lower part of the abdomen. For some girls the pain will be seen only in the upper part of the abdomen. So there will be different methods of the pain expressed by the girls. Along with pain, some of the girls would also speak about vomiting or might be a sense of vomiting, which we call it as nausea. So this vomiting is not always common in each and every girl during the menstrual bleeding phase. Most of the girls would speak about this sense of vomiting or might be a feeling of vomiting usually prior to the onset of bleeding phase. So this bleeding phase, as we spoke up, is from the first day to the 5th day in a normal cycles. So some girls would speak about this sense of vomiting or pain which would start around 2 to 3 days before the bleeding to start and would stop after the bleeding starts up. For some girls, these problems might be this pain, vomiting or any other problems. They can start on the day of on the day of the menses when the bleeding starts, but the pain can subside within 1 day. For some, the complaints can go ahead till the end of the bleeding phase. There will be difference in this pattern of presentation. Some girls would, like we can see, they speak about weakness to be felt during the bleeding phases very commonly. Like they say that they get pain in the legs or weakness in the legs, or it can be spoken that they cannot stand, they feel giddiness. These are the common things which are going to happen if at all their general health or the nutritional status is not to be proper. Along with this, most of the girls would show a pattern of different patterns of the mental irritations. Like it can be in the form of severe anxiety, or might be, it can also be in the form of anger. They can show, like especially the early part of the teenagers, like where we speak from 14 to 16 years, this period they try to show different tantrums also during these phases. That's possible to happen because there are some neurotransmitters or the enzymes which are going to control the normal brain functioning, and this gets disturbed, or the levels of these neurotransmitters get disturbed during the bleeding phases. So these girls may try to show the different patterns of irritation. Some girls would try to show only in the form of depression, or might be they would only sit and cry. The crying can also be because related with the pain or the vomiting also. And very important, the most important symptom being told or the problem being told by the girls of this particular age group is excessive bleeding. In general, or it is just spoken as excessive bleeding or heavy menses. In medical terms, we call it as pubertal menorrhagia. Now this excessive bleeding is not again fixed up for each and every menses, as like month to month there is a variation either in the intensity of the pain or vomiting. So also the same thing would happen even in terms of the bleeding phases. Some girls would show, or they would come and tell you that the bleeding would be very profuse, like too much of bleeding, and it will be lasting for around just 2 or 3 days. But some girls would speak that their bleeding phases are too much, like it goes for around 7, 8 or 10 days also. It is important for us to observe what changes are happening during these bleeding phases, like whether it is a continuous bleeding or whether it is an episodic excessive bleeding to take place. Most of the girls, like they would speak that these bleeding phases are going to keep on altering, especially with their physical activity. So if that's the pattern, it is necessary to understand the physical pattern, physical activity pattern of these girls. And all these problems which can be easily solved without any medications. If at all we try to understand when and how the problems are going to happen, these problems can be easily taken care of. So we can advise these girls to go ahead for the self-care to maintain the normal menstrual cycles. Very first important point is about the food and nutrition. In the present days, we see that there is a change in the trend or might be in the pattern of the food and the nutritional intake of the girls of this particular age group. We see that the normal food or the healthy or the hygienic food which normally our ancestors would speak about is not being handled by the girls of the present age. Most of them are more like their mind is diverted for the fast foods and the outside food, and the method of preparation is what concerns. So also the quality of the ingredients also do matter here. So if at all these things are being observed and being rectified by themselves, these girls, if at all they observe and rectify themselves about how and what food they are taking, so also what changes need to be brought about, they can easily try to see that their health can be maintained normal without any much of medications. Exercises. It's a big problem in the present days wherein the students might be from the higher primary school or up to the college level. It's because of their scheduled study pattern as well as the modes of traveling which do not give them sufficient time for the exercises. This is the point which is more important, where everybody has to take little time for their personal care. So if the exercises are being maintained by each and every girl, especially at this age, they will not have any problems, not only in the present period, like for the period of their teenagers, but so also in the adult life also, their problems or their health related issues can easily be solved out. So it is mandatory that every girl has to go ahead for maintaining the exercises. Exercises can be in any form. In the present days where we see most of the people are related or they are more interested to go ahead with the aerobic exercises or the Zumba exercises, so those also can be taken up. It is no hard and fast rule that exercises should and must be done on everyday basis for the same particular period of time. It can be fluctuated along with exercises and yoga, about certain days to go ahead for the exercises, certain days to go ahead with the yoga. Exercises can be indoor exercises, can be outdoor exercises. There is no hard and fast rule that only by going to the gym their health can be maintained. Even the simple exercises can also help out for solving these minor problems of the girls. Most important point comes up is with the sleep. The sleep pattern for the present generation is completely changed up. Do I agree that this is the present trend? But important is, whatever time the sleep has been started, the sleep has to be for a minimum of 7 hours for any of the children's what we speak up to around 20 or 22 years of age. So if at all it is a proper 7 hour sleep, and once getting up, every person is going to feel refreshed, not drowsy, lazy, or not that they are going to have like the full day of drowsiness to be felt, or even in that 7 hours of sleep, if at all they are repeatedly getting disturbed, on and off they are getting up, waking up for one or the other reason, then that is not to be called as a normal or a satisfied sleep. The satisfied sleep should be wherein the person is not going to get disturbed on repeated intervals, and once they get up in the morning, they should not feel lazy to lie down in the bed for a longer period. 2 to 5 minutes of rolling in the bed in the mornings, many of them consider it to be normal. But important is after that 5 minutes at least, the person has to get up and move ahead for his routine activities. So if that pattern is being maintained, naturally the sleep itself is the area which is going to heal or might be repair all the problems of the body, whatever the problems have occurred for the day. And if a person is going to lose the sleep for days together, naturally the body is not going to function normal. If the body is not going to function normal, naturally for the girls, the menstrual cycles are again going to be disturbed. So if they are able to manage with simple things at home, naturally these problems can be solved out. Like for the pain, the girls can try to go ahead using hot water bags or home medicines, which are always the best things. If nothing of this helps up, then they have to rely on the medicines. But here, mind it, that the medicines are not necessary to be taken for months or years together. Only when the pain is severe, take the medicine. Once the pain has reduced, stop the further medication. And medicines for any of the problems should never be like over-the-counter medications. It is always better to go ahead and contact the physicians, the nearby family doctors, or might be a gynecologist, and go ahead for take the prescription from the doctors and go ahead to bring the medicines. If at all it is vomiting to be seen more commonly, which is going to be again due to the hormonal imbalances of the body, it is always better that they avoid the spicy and salty food. That is very important. And intake of water should never be reduced, because intake of water if reduced, the weakness is going to be increased. And if the vomiting is too much, like recurrent episodes, then it is always better to rely on the soft food instead of the hard bolus, or might be the regular food. They can try to go ahead for soft food or might be the liquid diet for 1 or 2 days, and later ahead again back with the normal regular food. For the weakness, very important, the present generation has to understand about the good food habits. As spoken earlier, the junk food or might be the regular food being taken from the street vendors are not going to help them for the perfection about their health, because the quality of the food, the time duration of when the food is being prepared and how long was the shelf life of that food already been stored, what was the method of increasing the shelf life, what additives have been added, all these do matter for the generalized weakness. So this weakness doesn't happen on a single episode. If such habits of the might be the food habits or the nutritional habits are being not considered for a longer duration, any one cycle also can give a severe intensity of weakness. So also, as said, sleep duration, if at all been properly maintained, then there will be no problems. Even the picture or the problems of weakness get repaired by itself. Mental irritation, as spoken, there will be different methods of the presentation of these girls with the mental irritation. Like some girls, because of their heavy pain or heavy menstrual bleeding, they may not be able to go ahead for their regular activities. Like some girls who are very much fond of landing up, or they are bound to take part in the sports or might be the cultural activities, but due to these disturbances during the bleeding phases, they may not be able to attend those sessions, and that could also give a severe picture of mental irritation. So in this situation, it is the duty of all the elders, might be in terms of the family members or at the school, the teachers, who need to convince these girls about the meditation, the yoga, trying to keep the mind calm, and how and when the physical activities have to be taken up by these girls. So if such advices are being given at regular intervals, regular sessions being conducted, the mental irritation would reduce not only now but for the further part of their life also. So for the mental irritation, if the girls are trying to show severe anxiety, more important is to see that they go ahead with the meditations and the calming of the mind techniques, what are more important. If the girls try to show the mental irritation in the form of constant crying, sadness or depression, then they need internal motivation, which is not so easy, but external motivation, trying to put these girls or trying to take these girls into the society, trying to show how the other girls are trying to like with the same problem, how are they trying to cope up with their physical problems even during the menstrual phases. If such stories are being told, might be the depression or might be the sadness can be solved out. It is many a times observed that because of this mental irritation, more than the pain or the vomiting, it is due to this mental irritation where the girls are skipping the schools, especially during these bleeding phases. Either it is due to the shyness during the bleeding phases, or might be because of the heavy discharges, they feel awkward to move around in their classrooms. So the attendance which is going to be shortage, the study is which is going to be affected, is a big problem for the future of these girls also. Hence, the mental irritation or might be any of the mental problems in general, if at all been cared up and properly concerned and advised to them in a better way, this doesn't need any medication as such, but it is more of the counseling which is supposed to be done. Recurrent sessions of counselings are needed for such of the mental irritations. The next important point comes out to the excessive menstrual bleeding. So here, during the girls who are very much involved into the physical activities, like might be in terms of sports or the dances, so they feel always okay. But whenever there is a picture of excessive menstrual bleeding for any of the girls, it is better to advise them to go ahead for rest. Vigorous the movement may try to increase the physical menstrual bleeding phases. The physical activity should be limited. I do not say that it should be absolutely stopped. The normal physical activity can be maintained, but the vigorous activities should be avoided during these phases. Along with this, there are many of the home medicines which can be prepared, and if that is being taken care, naturally the bleeding phases are to be handled for that particular cycle. Very important is to advise these girls about the extra care of the hygiene to be maintained related to the private parts. It is in terms of the frequency of changing the pads, also the cleaning habits related to the private parts, and out of fantasies, there are people who try to indulge into many of the unwanted things to be done. So what has to be done, what not, it will be a proper counseling to be done as one-to-one if at all any of the girls of this age come to us. So these are the things which basically even we as a homeopaths do take care whenever any girls do come and speak to us. So apart from the basic treatments or the basic care, homeopathy is having a good scope in dealing with such of the issues. We see that our medicines like which are being used on regular basis, most of the girls do come to our homeopathic dispensaries, or might be even in our college they do come up, and there we are trying to see that more of counseling is being done, the general care is being spoken to them, and then we add up our homeopathic medicines. Homeopathic medicines which are only going to solve out the problems without any side effects. So the medicines will be based on the type of pain, the area of pain. So also the quality of the menstrual bleeding, the quantity also, because every girl will not have the same pattern of the disturbances. The same girl also will not have the same pattern of menstrual disturbances throughout their life. It keeps on changing. So every moment whenever there is a change, a new medicine will be given. It is not that these homeopathic medicines once been given, the same medicine will be continued till a long period. As and how the menstrual pattern changes, the amount of bleeding changes, the type of pain changes, the medicine is being changed every now and then. So it is a direct targeting of the problems for the girl, as considering all the problems of the girl as a whole. Because some of the girls will come and say during that severe pain they don't like to eat, or might be their thirst has completely stopped, or some girls would speak that during the bleeding phases they do have constipation. So all such minor things are also being considered when we try to treat these girls, and because of this we see that there are many girls who do come to take homeopathic medicines. Basically, these medications need only for a short duration. Like most of the girls need a short duration only whenever the symptoms are present. These problems need not be taken care, or might be the medicines to be done for a longer duration like 3-4 years and all. Most of them need is only whenever the problems do come. Whatever the problems will be, that condition will be observed and then the medicines will be given. Very few girls may need medicines which may go ahead for 1 to 2 years, not more than that usually. Basically, the biggest question comes up is, if at all the medicines will be taken for around 1 year, 2 years, what would be the side effects? Practically speaking, homeopathic medicines do not have any side effects because these medicines are non-steroidal medications. As it would be seen up with any other system of medications, here our medicines are properly prepared up under the observations. They are being tested, verified, and because they are non-steroids, these are the medicines which are being prepared from, like which are being processed after the particular studies, and the processed from the same products or from the same raw materials which we use them as the home medicines. Hence, naturally I would say that these are non-steroidal medications and they do not bring any side effects. Or else, if at all it is a steroidal treatments being done, naturally they are, or those medicines are going to bring adverse effects if at all being taken for more than 2 years. That's the reason, even if at all any gynecologist do speak about such medications for these girls, no person will ever give any of such medicines for more than 3 months. That's the routine pattern what happens. But there are people or patients who go ahead for medications to be brought over the counter without the consultation of the gynecologist, and they keep on taking the medicines for a longer period. At this age, naturally the side effects may not be seen, but the problems of these medicines can be seen in the later part of the life. Hence, to advise that no such over the counter medicines should be done, and it is always safer with the homeopathic medicines. There are a lot number of medicines in homeopathy, and from one person to other person, as the picture changes, naturally the medicine also is going to differ. So even if it is a homeopathic medicine and the other girl also wants to take the homeopathic medicine, whatever medicine being given to the first girl cannot be the same for the second girl. It may, sometimes it may be same, but most of the time it will be a different medicine based on the total behavioral pattern, whether it is in terms of the food habits, the sleep habits, the thirst, or might be the routine activity of the girl, or might be the type of pain. All these things are being considered, and hence the medicine differs from person to person. And hence it is advised that for the homeopathic medicines, naturally the action is seen very quickly. Within 2 hours, the problems of pain, vomiting are being solved out. If at all there is excessive bleeding, with homeopathic medicines, the bleeding is brought into control within the next 4 to 5 hours. All these things can be done very easily, but for these things to happen, naturally, it is a need that we need to contact or come in consultation with a homeopathic physician. So, by the end, we have seen that the different sufferings of the girls during menstruation, either in terms of pain, vomiting, how would the mental irritation take place, how would the girl behave during the menstrual bleeding phases. So, those were the sufferings what we have listed out, and we have also spoken on the knowledge of how to maintain the normal menstrual pattern. That is again about the self-care, about when to sleep, why that particular hours of sleep are needed, how to think about the food, nutrition, or might be the exercises, and more important is when and why to take the homeopathic medicines. Very important, as the last part to be spoken is about homeopathic medicines are always safe without any side effects. They do give a quick action whenever there is a short duration of problem, and the symptoms are very specific, and the patient who speaks to the physician, they speak everything openly. The medicines to be selected are always going to be the best one, and they do give a proper care. And by taking such homeopathic medicines for the teenagers, naturally will boost up their confidence for their routine studies, for their daily activities, whether they are going to participate for any of the competitions, might be for their exams, might be for any of the cultural activities. So their routine part will not be hampered by going ahead with the homeopathic medicines. That's the important thing what I would give up as a message. Homeopathic medicines will try to reduce your absenteeism from the classrooms. So that's the end of the session. Thank you.